This videotape illustrates the therapist's role as consultant to families with children who have eating problems because of developmental disabilities. It will stress the importance of supporting, yet guiding the parent or other caregiver toward more appropriate feeding methods, leading to the child's increased eating skills, and facilitating positive interaction as well as improved function. Teresa, a 3-year-old child with cerebral palsy, is observed while being fed by her mother during segments of an informal feeding evaluation. According to her medical history, Teresa was delivered by cesarean section because the cord was wrapped around her neck. She was tube-fed for 2.5 months in the intensive care unit and for another month after coming home. Teresa is significantly delayed in most areas of development, including feeding. The straps, what is the purpose of the straps?
She hasn't been using the straps. You haven't been using the straps around here, have you?
A tumble-form chair was usually used for feeding, with her trunk and hips well supported by a system of straps. But muscle tone was increased in the shoulder girdle and upper extremities, and her head was not stable. The ATNR, or asymmetrical tonic neck reflex, was observed intermittently as Teresa's head turning produced obligatory extension of her face side arm and flexion of her skull side arm.
The pelvis does look like it's in neutral. So what kind of food are you feeding her right now, Lorna?
This is ground oats, corn also ground, and then some baked potato. The baked potato has been ground up.
And do you use one of those baby grinder things, or do you have something else? Okay, so it's a coarse texture.
Mm-hmm.
Okay. And this is the consistency that is probably the most closest to normal that you can do. She can't handle any other kind of table food where she'd have to do a lot of chewing. Is that correct?
Right.
And how do you feel about the variety of foods that she's getting right now that meet her nutritional needs? Are you comfortable with that? Do you think that most of the needs are met, or are you concerned about some particular nutritional needs?
Well, as far as giving all of her vitamins and things, I try to. She has our basic meal with us, and then sometimes she will have baby food. And then she has the instant oatmeal in the morning, and she has juice.
Mm-hmm. So when you think of all the food groups, do you feel they're pretty much covered?
Yes.
How about roughage? Do you have problems with constipation?
Yes.
So that's one area that you're really concerned about, and it is hard. All right. Let's talk about methods then. I'm going to be watching. I won't go to sucking right away, but I will ask you, does she still take a bottle?
Yes, she does.
Milk? How
yes.
often?
3 times a day. It's not a bottle.
Okay. And does she use a cup once in a while as well?
Yes. Every morning she has juice in a cup.
Let me try, and we'll see how this goes. Yes. Now with the cup, what I'd like to do is get her to suck on the cup. I can't see. Mm-hmm. I'd like her to somehow use that to suck on. And I think cup drinking is a real hard thing to get. And I think you can get more of what you want with the spoon. And once you get the spoon the way you want it, the cup comes easier. Ready? Okay. Yes. I'm not pouring much, am I? Because I can't see that well. Good girl. Good girl. You're quieter. Now, as far as the tongue, yes, I don't want the tongue inside the cup either. Okay, honey. I think her cup drinking has potential. I think you've worked at it hard, and I think it's coming nicely.